Hello and welcome. My name is Madito James and I'm delighted to be your host for this podcast, This Female Body of Mine. This podcast is focused on women's health. What does it mean to be a well woman, especially for our continent in West Africa? We are going to cover topics that have not been talked about often, but are very needed. From the moment a girl approaches womanhood, her body is changing. The demands, both from within and externally, increase. How does she navigate all of this and still maintain her health? I'm happy to introduce to you the first episode of this podcast. We had the pleasure of having a sit-down discussion with Dr. Eno Angela Attah. Dr. Eno Angela Attah is the Executive Secretary of Akwa Ibom State Primary Health Care Development Agency, and she is a public health professional that has a lot to share about women's health and wellness. So why don't you grab a cup of tea, a cup of matcha, juice, or good water, and enjoy this journey into this female body of mine. Good afternoon, Dr. Eno Angela Attah.
Good afternoon.
Good afternoon.
Good
It's so good to have you finally on the podcast.
I'm so excited to be on your podcast.
Thank you. You know, one of the reasons why we started this female body of mine is
Right.
to make sure that there is information online for West African women, African
Right.
women who don't have access to healthcare and who have questions about how to be well as a woman.
Yeah.
And we are so happy to have you here to tell us more about how we can be well.
So yeah, it's a pleasure. I'm really excited. When I first heard that you were doing the series, I thought, yeah, what a great idea, and I'm happy that we finally made the connection. I will do my best to share what I've learned in how many decades? 5 decades plus and counting. 5 decades, yes, of being here on earth in this female body and as the medical professional. So it will be my pleasure to contribute and help other women too.
Thank you for that intro. If you did not tell it to the camera, we would not have guessed more than 5 decades of this. So, can you tell us more about your journey, about yourself, and about your career, what you do currently?
Okay, so once again, my name is Dr. Eno Angela Attah. I am a public health practitioner. I am currently the Executive Secretary of the Akwa Ibom State Primary Healthcare Development Agency, a role that I've held for about 7 years now. And I've been very privileged, I must say, because when you're handed a trust, I see it as a trust, something to go out and ensure that our people get connected to the right healthcare services at the community level before they need to be referred to other levels. So I see it as a trust, put into my hands, and I hope that I've been able to at least move the needle in terms of primary healthcare access in Akwa Ibom State. So that's what I do currently. But before I came to this role, of course, I studied medicine at the University of Lagos for the number of years that you usually spend, including a few stops during like university strikes. But when I was doing that, it wasn't so long, unlike what our students are currently facing today. And so my graduating class, we have a joke about graduating in the year we're supposed to graduate +1. So like an extra year was added through no fault of our own. But it was quite a journey. And I remember even as a medical student thinking about what areas I wanted to specialize in and what was really speaking to me, because I always want to be led with purpose. Okay, so you're a doctor, but what kind of doctor exactly? And how does that come through you, the person that you are? So settling on public health wasn't an instant thing. It was just going along the way and feeling out what I was more comfortable with, what spoke more to my innate character and innate talent. And that's how we ended up here where we are. Along the way, I've been also opportune, privileged, I would say, to be able to speak to women about their health, and in collaboration with organizations, and I've had quite a would I say fruitful time being a medical practitioner, but not in the traditional way that people will expect. Um, I remember some young girl came to my office to say hi, one of my staff members' daughter. And by the third time, she told her mother apparently that, is doctor a doctor? Like, because this is a different doctor. Every time she come to my office, first of all, I'm in an office. I'm not in a clinic, I'm not in a consulting room. I didn't have a coat, and then there was no stethoscope around my neck or somewhere on my table. So she was convinced I wasn't a doctor. And then I was always nice to her and didn't give her any injection. So no, she probably isn't. She's too nice to be a doctor. But so that's where we are. That's what has brought us here, brought me here where I am today. That's it.
Thank you for sharing that journey. And we're going to go more into pursuing a career in public health. But I just wanted to ask you about when you said you've been in the domain of women's health, because this podcast is specifically our target audience is women. So what have you seen have been the major health diseases or diseases that have faced or challenged women's health, especially in our region in West Africa?
So majorly, life is stressful. First and foremost, life is stressful. And it's how you deal with the stress that determines how it shows in your body, how it turns up in your body. There's a popular slang, pidgin slang, that says "body no be wood." Like, yeah, at all. So you have to be cognizant of what you're doing to yourself, or what you're allowing yourself to go through to get the optimum out of the same self. So you can't push yourself for hours on end in a high stress environment such as our country is, and then expect that your body will be performing at tip-top condition constantly with no rest. So that's just a no-no. And so for women, because of our build the way we are made, we seem to, we're the nurturers, we're the ones that bring life into the earth. Even that that episode of bringing life into it takes a lot out of you. It takes its toll on you. From conception, the child, I remember one of the things they used to teach us in medical school is like, child is actually like a perfect parasite. It's feeding off of you for its own end. It's not thinking, oh, does mommy have enough calcium? Yeah, on your own if you don't have enough calcium. I'm taking what I need. Do you understand? 100% of what I need is what the child is going to be drawing from. What the child needs, 100%. So if that leaves you with 20% of what you need, that's your business. So that's why we try and encourage that women have supplements, that they pay attention to their diets, especially when they're pregnant, and providing for another living being within them. So women face a lot of challenges, and then before you even get to the conception bit, because you're a woman, you're going through monthly periods, which are preparing for this eventual occurrence. It's all about preparing for you carrying a child. So the uterus gets more blood supply, and it is laying down more layers of the lining, thinking that there will be a child at the appropriate time in the cycle. And that takes a lot of material from you, takes a lot of nutrients from you, iron, it takes so much from you every single month. And then when there's no child, when there's no fetus implanted, everything gets shed. So you're losing on a monthly basis. You're just losing the minerals, and then it's not as if you get an extra portion at home. You're just supposed to. And sometimes, unfortunately, culturally, women, you get the least, you get the dregs. So you're the one preparing the food. Is it okay that you're the one getting the dregs? No. So we need to be more intentional in terms of our diets. Diet isn't really about the size of it's about how adequate it is for you. If you know it, because as a woman you're depending on, like taking or pulling up so much more iron every month, so
Right.
immediately that's what you need more than anything else, you understand. And the calcium, so all of these different nutrients and minerals and vitamins and supplements, we should make sure that we intentionally have more of it in our diets. Luckily for us in West Africa, we love our green vegetables, and so, but it is, how do you process those to retain as much of the nutrients as possible? Shouldn't be something that you're reheating over and over again. No. It should be what is fresh, or the freshest thing in what you're eating. So I could go on and on, but I remember it's just reminding me of when I used to do the wellness talks for women. And so the idea was that we eat a lot of soups at this, in West Africa, but it's vegetable soup. So the idea was, have a soup base.
Okay.
Do you understand? Have the soup base and put in your vegetables last, so that if you need to keep reheating, you're heating up the soup base and adding fresh vegetables each time. It sounds like a bit more trouble, but I think we should go to a bit more trouble for ourselves. So that's
For me, that does not sound like any trouble at all.
At all.
I mean, food is medicine. And like you said, we have a lot of vegetables. So I'm a woman, I know I need my supplements, I need my nutrition. So which vegetables should be my go-to in West Africa?
Okay, so first of all vegetables, but I mean specifically green leafy vegetables have been known to have higher contents of iron, for instance. So for instance, our common ugu is very high in iron, and people call it pumpkin leaves. So, but every other vegetable, so ugu is also nkong. We like atama, we like afang, we like water leaf. So any green leafy vegetable is actually good for you. Water leaf, yeah. Editan, do you understand? So all of those, and then we have this idea of, if it's bitter, then it's better. It's better for you, but not necessarily, as far as I'm concerned. But it's just that it might have other nutrients that you might not find. But it's not as if that's the only thing you should eat. You should eat a wide range. Eat more of fresh fruits as well. And for me, it's always not about the quantity. Once again, don't OD on things. Anything anything in too large of a quantity will not be good for you at the end of the day. So don't say, well, it's only green leafy vegetables. So you now do, too much of that.
Diet, breakfast, lunch, and dinner. Rice and
with nothing else. You should have an assortment. You should have a variety. You should have, variety is important, so that everything doesn't have all you need in one.
That's true.
So if you have a variety, you're more likely to add up to the different, with the different nutrients that you need. And so for other nutrients that you might need, just eat a wide range of food. Even if it's tubers, it's also the way you prepare them. And don't let the carbohydrates take the larger portion of your plate. If you're thinking about one plate and you're plating of food, let there be more fruits and vegetables. In fact, up to half of the plate should be more fruits and vegetables. But I still like my fufu, so I would, I will think about the portion size. I remembered when I would do the wellness talks, and I'm there telling women, first of all, make a fist, and that is about the size of this. And they would laugh me to scorn, like, is that what you're doing? No, you have to be, full. You have to be belly full or something. So I'm like, no, it's not about also being full. It's not about being portions, but eating what your body needs. Does it need this? Because then you'll be, veering into obesity, which has its own issues as well. Somebody that is obese can actually be malnourished.
That's true.
So it shouldn't be about the quantity, but about the quality of the food, the variety of the food you're eating, and the freshness. The fresher it is, the better. Try not to overcook your foods. and you'll be good.
Yes, I like what you said about having that soup base because it gives you the potential to have nutrients.
Yes,
So
yeah.
just add a bit of vegetables. And I mean, lately there has been so many, like I can call them fads.
Yeah.
People telling you, okay, blend your ugu or put it in your smoothies. So, what would you say? I mean, you have the group of women who don't have access,
Right.
and then you don't have access to quality nutrients, and then you have this other group of women who have access to quality nutrients but may not know how to pair it. Like what should women remember? At least just 1, 2, 3 things that they should remember each time they're thinking or they're planning for their family's meals.
Once again, I think, especially if you're a visual person, in terms of the plating, make sure that whatever you're buying to make your meal together, at the end of the day, should come to about half in terms of fruits and vegetables.
Okay.
And then you have your protein, and and don't exclude all this oilless eating.
Okay.
That's another thing. Fat and oils are actually essential, especially
All
for your
oils,
nervous system.
cotton seed oils and palm oils.
I know there's the whole debate, but if you look behind it, I'm not even going to say much more about that. It's always a marketing going on. That's
true.
bottom line. What were your ancestors eating before then? Suddenly palm oil is totally anathema. Do you understand? Oh, it's a this, it's a that. Oh, really? And then you had ancestors that way. How did they process it and eat it? Then that was good for them. Do you understand? As opposed to some other old newfangled theory that says that, and then where are we getting those things from? Is it here locally, or we now have to look further afield and have some imported oil so that we'll be healthy? You think about it. It's not every single, do you understand? Just think about it. So, but fat and all that essential. And once again, if you look at the food pyramid and the portion that they take up, it's a very little portion. Do you understand?
Right.
It's very, very slim. But it shouldn't be totally out of it. If it's a fat that people are saying, oh no, don't have oils at all. Okay, let's watch and see the effect on your central nervous system, for instance, because the nerves are sheathed with what essentially you get. Do you understand? So you need that cushioning for your nervous system. But I'm not saying now have ladles of oil just because that's you yourself looking at the greasy burger, you know that's a bit too much.
Yeah.
It's a bit too much. Yeah. So that's it.
So let's shift from nutrition and wellness. Can we talk more about something that I first heard you say, my first interaction with you, and it was at the vision board meeting, and you said every woman every year should do a well woman check.
Right.
I mean, it sounded like a supplement. Sounded like a well woman check.
Well woman vitamins.
And I walked into the hospital, I was like, I want to do a well woman check, and they looked at me.
They're like, what's that?
So can you tell us more about the need for women? Why should women do a well woman check every year, and what does that actually mean?
Actually, everybody needs a wellness check.
A well human check.
Yeah. So for instance, when babies are born and are going through their immunizations and stuff, they have to keep coming back in, not just for the immunization, but for a well child check. They might not call it that in our health facilities, but that's what it is essentially. It's the child growing well. It's the child reaching their growth targets. Is there some kind of sport going on? So it's the check that you do when the person is well, ostensibly,
Right.
before they are unwell.
Yeah,
So that
sorry to interrupt you. I actually read a book and it said, by the time you fall sick, you've already been sick.
yes.
It's not.
And
when
imagine
you're sick
you
that
have picked something up during a wellness check, and you say maybe you're not so well after all. So that's why it's important. It's like a vehicle maintenance. You have it's actually Ministry of Transport, but an MOT check. And you have certificates, particularly in other states. Yeah, well, I think we have them here too, where they look through your body is a vehicle. Is the most sophisticated piece of machinery that is out here. That's how I see it. The functioning of the body is so intricate. I mean, for some of us that, read our Bibles, it's like you're fearfully and wonderfully made. It's not an exaggeration. It's true. And even going through anatomy and physiology as a medical student, young medical student, if you know the amount of nerves running through your hand just to make you close and open, so everything must be running tips. So I remember more recently, and I mean, I'm not in training anymore, but just seeing how practically the absence of some electrolytes or just a little reduction in probably sodium or potassium in the body, that's like you're dying either from hyper, like either your body, your heart is beating too much or not beating at all, just because of these two elements, potassium. You understand? So your body, your body is an intricate machine. It's a piece of machinery. And then, so now that we are looking at it that way, because that's how I've always looked at it. And actually, like, I have some books out for children on wellness. So for the one on nutrition, I actually related what we eat to the way we, and then the fact that you need to drink water. You need to hydrate this machine. You don't want to overheat. You don't want to, yeah. So all of those things. And so how do we get here? Woman checks. So yeah, so we do need to have those checks. And maybe I'm particular, I'm biased because I'm a woman. And then there are other things. So imagine a woman that every month, during her, first of all, she pays attention to her menstrual cycle, and she knows that it's like a 26 or 28 day cycle. Everybody is not the same. What is normal for one woman is not normal for another. So if you say, no, it has to be 28, that's what I see, and that's what it is. No, some other woman might be 24 days, and that is absolutely normal for her because she has checked it over the months, over the years, and it's kind of like settled into that mode. And so that is her cycle. Everybody's cycle is different. And then being able to say that this is when it comes, or maybe I'm more prone to having period pains, and this is what helps, this is what might trigger it. So as a woman, first of all, have that baseline of yourself, and then also determine, okay, at what points am I examining my breasts? As a young woman, you should be able to examine your breasts, and once you're taught, you have to go through these 4 parts so that you don't miss any part and say, oh, it's just a general random. No, there's actually an intent just to make sure that there's no lump, nothing unusual. And how will you find not anything unusual? Because there's a usual. There's a usual. You get a usual by checking every month. And so when you come for the wellness check or the well woman check, you should have a clinical breast examination. Apart from the self-breast examination, they might go over it again with you and say, okay, what do you do? Just to let you see that, whether are you standing in front of a mirror so that you can see if there's any lumps or any puckering of the skin. It's like getting into your car in the morning and making sure that you top up the water, the oil. Why would you jump out and not do anything for yourself? So it's very important. It's actually very important. And so for the wellness checks in the hospital, apart from helping you with check what you do for the self-breast examination, they also do a clinical breast. So that means that it's the clinician, whether it's a nurse, whether it's a doctor, or which health count that will check. So somebody checking might pick up something that you are not able to. Yes. So they will do that. And then because you're female, you have a uterus, you have a cervix. And we know that cervical cancer is one of the cancers that has a high mortality for women. I think it's the highest. Is it the highest or the second highest between breast and cervical cancer? Killer of women by the time it's out of control. And it's usually out of control because there's no screening, that the woman hasn't done the screening beforehand, and it's only when you see there's something wrong. Meanwhile, something has been going on for so many years or for quite some time. So you can do a cervical screening at that time, and then also do the blood work. So check if the woman, remember we talked about women bleeding every month. So more likely, yeah, so more likely than not, most women are walking around anemic and they don't know it. You know, oh, sometimes I just feel tired. Sometimes then a woman that is pregnant and she came in anemic into the pregnancy, and then the baby is there like perfect parasites. I don't know what you want to eat, but me, I need this, I need this. So every day the baby is doing buffet, picking what they need, and then you are, at a loss basically. So they'll do those basic tests. Of course, also check, this is West Africa. You also want to check malaria, yes, and not typhoid, because that is not one illness condition. Most people say, "Oh, I have malaria, typhoid." It's nothing like that. So, but
You're
if
telling
you
me that I have malaria
that combo
and typhoid, that's
from one test, no,
the
that's
wider
totally
you can bin that
one, yeah, totally been that side of it. As and a West African eating in this West Africa and drinking the water that we're exposed to, you will have some titer of typhoid. There will be some, but the definitive test, if you want to use the vitals test, is to see if it's a rising titer with other clinical symptoms. Is a person, febrile? Does the person have other GIT symptoms? So a one-off test is not a diagnosis for typhoid.
Oh, that's
Nope.
interesting. I'm just hearing that for the first time. I know people often say, I have malaria and typhoid.
And
I
typhoid.
think that's one of the most common self-diagnosis.
And then, unfortunately, the medical professional are not saying, no, there's nothing like that. Because if you go to a private hospital, either it's their lab or they'll send you to a lab they know. So they'll order these tests.
Right.
Whether or not do you understand? I don't want to go. They say, see, it's high. It's high. It's high just at one instance. Do it again. Do it again. Give it some time. Do it again. And so if it's much higher and you do a third one and it's rising and then you know that, okay, there's an issue there. But not a one-off test. Yeah. So you do those tests, then you also do check the electrolytes and urea, that's all the sodium, potassium, chloride that I was talking about. You just want to see where the body is at in terms of, how all these things working together. Once again, back to the analogy of the car. You have your battery in the car, and then you're putting in battery water or whatever to make sure that it's got all the ions in it. But you need to make sure that everything is going well. Otherwise, you see somebody that is really sluggish. For instance, this is very easy. For instance, when somebody has had diarrhea and has been vomiting as well, and you know how the one would feel very lethargic, you've lost a lot of salt, you've lost a lot of fluids and the electrolytes. So it's not just the fluids anymore, the electrolytes. So that's why we encourage people to take ORS, which is a combination. It has some salt, it has this chloride, it helps to get you back to some kind of balance while you're going through this phase. And then if you need to have more medication, then of course your doctor can direct you appropriately. So yeah, your body this body is amazing. So it's how to take care of it and be intentional about taking care of it. For the wellness checks, you only need one check.
Welcome back from that exciting episode with Dr. Eno Angela Attah. I'm sure you may have a lot of questions for her, so do drop them down in the comments section. And do well to subscribe so you don't miss the next installment with Dr. Attah. The podcast, This Female Body of Mine, was brought to you thanks to the support of the Africa Center's Women Creatives Exchange Program. We know that you are eager to know what's in store for future episodes of the podcast. So, do subscribe and watch out for the next episode, where we would have more discussions with pertinent and practical information for the West African woman. I'm your host, Madito James. Until next time, take care.